Hi everyone, today we're doing a simple skin signature treatment, one of my clients' favorites here at Michelle Megan Aesthetics. I wanted to go over that live video because it was in silence because I wanted my client to relax. So first off, we start with the Pre-Cleanse by Dermalogica. It is an oil-based cleanser. We go ahead and apply that as is. So I like to apply to the face and décolleté. So we work that in. So we work that in for at least 1 to 2 minutes. After we work it in, we go ahead and add water to emulsify. So you'll see me just dab my hands in the water a little bit to get it wet. And then we'll emulsify it where it turns white. And then we go ahead and use it to cleanse. Right, so we're emulsifying that cleanser here and working it all the way in. So what the pre-cleanse does is the first initial cleanse. It gets all that surface dirt and debris off of the skin before we start our actual cleanse to deep cleanse the skin. Okay, so after we've removed that off of my smiling client, we then apply our special cleansing gel. So that is our special cleansing gel by Dermalogica, and here's where I now will add steam as well. We do not add steam for the oil-based cleanser, or else it would not serve its purpose to remove all of that dirt and debris. All right, so here we apply the special cleansing gel. Work that in, and we have that nice steam to open up the pores and get that in for a nice deep cleanse. So again, we work that in for at least 1 to 2 minutes. Okay, so we are still working in that special cleanse. Nice. Now we're going to cleanse. After that, we are going to go into our exfoliant. With the exfoliant, you will see that I applied the Daily Superfoliant by Dermalogica, but this time instead of adding water, I added our Accelerator 35 to take that up to a level 2 exfoliant. So the Accelerator is a bit of what we would apply for a peel sensation, and that just gets under the dermis and gets the skin nice and exfoliated and clean, as they would say. So right here, I'm going to now mix my Dermalogica Superfoliant along with my Dermalogica AE35 to get that exfoliator nice and thick. All right, we apply our exfoliant with our fan brush. I try to keep it away from the corners of her nose and mouth, or at least not too close, because that AE35 will affect sensitive areas. So we applied it when I rubbed it in, which you'll see me do next. I will massage it in after I leave it sitting on the skin for at least good 10 to 12 seconds with steam. Then I start working it in. So my client, she has normal to oily skin. She is treating it right now with some of our Dermalogica products that I prescribe to her, which would be our Dermal Clay Cleanser. She uses as a mask once a week. She also has the Clearing Skin Wash, then her SPF, vitamin C for her hyperpigmentation, retinol 1% that she uses at night. That is by another brand that she already had, and her moisturizer at day and night. I do ask her to exfoliate once a week. She is currently going through some hormonal breakouts, so I've asked her to kick up her exfoliation to twice a week now. So we're just working in that exfoliator. So this daily exfoliant has a bit of a gritty, grainy feel. However, once you add your water, your 35 accelerator, and you mix it up, it turns into a nice foam. So I really love this exfoliator by Dermalogica. I also sell it here in store. So if you would like to come by and purchase some products, I do have all Dermalogica brand here. Right, so we're gonna remove that exfoliator now. So up next will be our extraction process. I do not like extracting comedones that are what we would say not ready. She had a few breakouts on her forehead, but we are going to try to get some of those up from under the skin. Those that we can't, we are going to treat with a charcoal rescue mask after. So what I'm applying here is our scaling gel. This is a desincrustation fluid. What the desincrustation is where we will get our blackheads and comedones. Well, blackheads are comedones, but our open and closed comedones and pustules and anything that's under the skin that needs to come up, we'll get it soft and easy to, you know, wiggle its way out. Also, what I am going to use is some galvanic. It is an electric tool that we use here in the spa room, which we use on the negative to help pull out those impurities. So what it does is when we go over the skin with it, it liquefies the comedones under the skin, helping it to come out easier and without us having to damage the skin, or like I like to say, mess with the integrity of the skin by, you know, forcing those comedones out. So you'll see me apply our galvanic tool here with gauze over the skin. When we use that, I remove the steam because the electricity and the steam is not a go. Okay, so we only use the galvanic on clients that meet the criteria. That will be clients with no metal implants, no pacemakers, those clients that do not suffer with high blood pressure, clients that are not pregnant or breastfeeding, and those that don't have, like I said, metal implants or any metal in their mouth, nipple rings, you know, those things, they will have to come out. So here we're just using our galvanic, and I have that setting on its lowest. I'm just going over where I see that the client has breakouts. So what I'm going to do on my client within 2 weeks, when she has no breakouts, is go ahead and do a glycolic acid peel on her within 2 to 3 weeks, which will help with her uneven skin tone from her breakouts and her hypopigmentation. So we're going to do that once she's not getting any breakouts or have any active breakouts at that time, because her skin is doing really well. We just want to bring her skin back to what she knows it to be. So we're just finishing up that desincrustation galvanic use. And then we're going to go into our extractions. My favorite part. So I use my extracting tool. Sometimes I use the ventouse, which is a vacuum-like type of tool to kind of suck those things out of there if it's not many to the naked eye. So I'm focusing more on her forehead area because that's where she's been having her breakouts. So we're just going over there trying to get as much out as possible. But those that are not quote unquote ready or still under the skin with no opening, I'm not going to force them out. I'm going to go over her nose to get out a lot of that oil congestion. That's usually everyone's sensitive spot, but that's where I get the most out of. Yeah, you can see she twitches a little. She's so pretty to me. And a lot of what you're seeing on her cheeks are no longer breakouts. It's hyperpigmentation and scarring from being a picker. So that's what the peel will help. We'll try to go ahead and reverse some of that for her when we get her to do a chemical peel within the next couple of weeks. And I'll definitely record that and have you guys take a look at it. So she has a few breakouts here, which I do not want to mess with. I'm just gonna go over it gently and try to remove some of the closed comedones that I have seen. All right, so I'm all done there. I'm going to just go over the forehead one more time. Hopefully the steam kind of softened that area up a bit for me. And when I'm done with that, I am going to go over her skin with our post-extraction fluid, which is antibacterial, because when we're doing extractions, we are bringing bacteria up and out of the skin. So be sure to cleanse the skin with a good antibacterial when we're done extracting to not spread that bacteria and germs. All right, so I have now added hyaluronic acid and niamycin. Niamycin is an ion active by Dermalogica for clearing the skin. And I also added some oligopeptide to help brighten some of those dark spots and help even her skin tone. So I've applied all three, and I am using my ion parenthesis, which is positive, to push those products into the skin. Okay. Up next, I'm going to add our charcoal rescue mask. So I usually use this mask on clients that have a lot of breakouts or acne prone. And we're going to go ahead and use that on her because she has been complaining of her breakouts lately. So I'm going to mask her with that. All right, so we're gonna let that mask sit for at least 10 minutes. And while that mask is sitting, I am going to apply what we call some touch therapy, which would be a great neck and shoulder massage. We do a little acclimation of the scent that we're using. That's what that was over her face. So yesterday we used lavender essential oils along with our massage gel. We just use this to relax our clients. Usually this is when my clients just go ahead and let go and go to sleep, because you don't want to leave your client just sitting with a mask and you've removed your hands from them. Their eyes are closed. They're very vulnerable. They're like, what's going on? When we're done, we're going to remove this with a steam towel. I know you can see the steam blowing. It's not directly over her skin, her face. We do not use steam with the charcoal mask because we do want it to set. In her case, I don't want the mask to get completely firm, so I just leave the steam kind of dangling, so to speak, so that way she can get some steam. It can keep some moisture into her skin because she can go from one extreme, since I've dealt with her skin, either really oily or all of the oil sucked right out of it. So, and we don't want that. So now I've put the steam back on her skin because I am now about to apply the steam towel to remove this mask, which takes a lot to remove. You'll see that here as well. So we're removing that mask with our steam towel. Like I said before, this mask takes forever to take it off, but we're getting there. I'm gonna use another steam towel just to make sure I get everything off of her skin. So we're gonna use one more steam towel, and then we're gonna go into our toner and moisturizer. Nice and clean. Okay, so now I am going to spray my client with toner from Dermalogica. So we're applying our toner, and then I'm going to apply our Active Moist by Dermalogica along with SPF 50 by Dermalogica. Once my clients come to me in the daytime, I always send them off protected from the UV rays. And we apply that on the face and décolleté. All right, we're just gonna work that in, and then she will be ready to go and glow. I thank you guys for watching this quick video. It's not that quick, but watching this video and allowing me the opportunity to explain step by step our simple skin signature treatment. Tune in for more videos on dermaplaning, chemical peels, acne teen prevention, and check out our blog on www.michellemeganesthetics.org. Also our Instagram and Facebook, Michelle Megan the Esthetician. Thanks for tuning in. Love